So again, good morning and welcome to the Louis Stokes Cleveland VA Medical Center Digital and Remote Health Center for Innovation ceremonial opening. I am Damian Horvath, your VA Northeast Ohio Public Affairs Officer, and I'm pleased to be your Master of Ceremonies. We are deeply honored to welcome our VISN leadership, national leadership, esteemed academic partners, healthcare innovation specialists, and dedicated staff of VA Northeast Ohio. Thank you all for joining us on this momentous occasion. Today represents far more than the opening of a new facility. It reflects years of vision, collaboration, and unwavering commitment by countless individuals and organizations working together to transform the future of veteran healthcare. The Digital and Remote Health Center for Innovation embodies our shared mission to expand access to high quality, highly specialized care through the latest advances in technology, research, and clinical innovation. Most importantly, this center stands as a lasting commitment to the men and women who have served our nation, a promise that our veterans will continue to receive the exceptional care they have earned, delivered with excellence, compassion, and innovation at the forefront. Now it is my pleasure to invite our interim VISN 10 director, Ms. Jill Dietrich-Mellin, to the podium for some opening remarks.
Thank you very much, Damian. Good morning, everyone, and welcome. Thank you all for being here today, our leaders from VHA, our academic and community partners, clinical staff, and most importantly, the veterans we serve. It's an honor to stand in front of you today as we officially launch the Digital and Remote Health Center for Innovation right here in Cleveland. Cleveland has never been a city that waits for the future to arrive. It builds it. From the earliest day of biomedical research at our academic medical centers to the manufacturing ingenuity that shaped this region and the health systems that have become national leaders in cardiac care, transplant medicine, and now digital health, this city has a track record of turning bold ideas into real solutions. This spirit is exactly why this VA Medical Center and this community was the right place to grow this next chapter. For the past several years, our team has been quietly doing something remarkable. We've been testing new ways to bring care closer to our veterans, not asking them to drive 2 hours to see a specialist, but asking how we bring that specialist to them. We've piloted remote patient monitoring programs that catch problems before they become emergencies. We've partnered with clinicians who are willing to try something new, even when new meant more work up front, because they believed that it would lead to better outcomes down the line. And honestly, it has. I want to take a moment to recognize the frontline staff here with us. Innovation on paper is easy. Innovation in the exam room, in the middle of a full patient schedule, with real people whose lives depend on getting it right is remarkable. That's the kind of work that's been happening here in Cleveland, and it's the foundation that this center is built on. So what does today actually mean? It means we are formalizing and scaling something that already works. It means the ideas piloted in a single facility, tested by a handful of dedicated providers, will have the infrastructure, the partnerships, and the resources to reach veterans well beyond this building across Northeast Ohio and as part of a national digital health effort. This is not a center about technology for technology's sake. It is about a veteran in rural Ohio who shouldn't have to choose between a 3-hour round trip and skipping a follow-up appointment. It's about a veteran managing a chronic condition who deserves to be monitored continuously, not just checked in once every few months. It's about giving our clinicians better tools so they can spend more of their time caring for people and less time working around the limits of geography and scheduling. I'm proud that Cleveland is a home for this work. I'm proud of the team that built the foundation that we're launching today, and I am proud that every person here today, whether you're a clinician, a researcher, an academic partner, or a VA leader who fought for the resources to make this real, chose to be part of something bigger than any one of us. In a minute, you'll hear from Dr. Lindsay Riegler, who will walk you through exactly what DRHCI is. Gotta get that right. What's in it for you, and how this work is laying the groundwork for bigger things ahead. But before I hand it over, I just want to say thank you. Thank you to the veterans who trusted us to try something new. Thank you to the staff who did the unglamorous work of building this from the ground up. And thank you to everyone in this room for showing up today to help us launch what I believe will be one of the most meaningful advances in veteran care to come out of this region. Welcome, everybody, and let's get started.
Thank you, Jill. It is now my privilege to invite Dr. Lindsay Riegler, Director, Digital and Remote Health Center for Innovation, to the podium. Dr. Riegler, thank you very much for joining us today.
Thanks, guys. Good morning. How's everyone feeling? I would like to personally take all of the accolades for the weather today. When we planned this event about a year ago, I thought, guys, what if it rains? What if it snows in Cleveland? Who knows? What if it's hotter than blue blazes? But really, we couldn't have asked for better weather. So thank you all for taking the time, and thank you for being here. Thank you, Jill, for your time. I want to start by telling you what is DRHCI, because the name Digital and Remote Health Center for Innovation is quite a mouthful. It's a center with a mission, and the mission is simple: to empower veterans to take a proactive role in their health by providing access to personalized digital and remote health solutions. DRHCI was established as one of VHA's National Center for Innovation to Impact, aligned under VHA's innovation ecosystem. And it was the first center to formally partner with the Office of Connected Care. That partnership matters because it means the work we do here just isn't about a local pilot project. It's designed from day one to connect to VA's national strategy. So when something works here in Cleveland, Ohio, it doesn't just stay here in Cleveland, Ohio. It can be validated and scaled across the enterprise. The center goals are simple. First, we want to accelerate the delivery of digital and remote health solutions for veterans and providers. To do that, we need to provide the infrastructure resources for providers to test, assess, and address the unique needs of veterans. Second, we want to watch these solutions in advance so that we can prevent care, watching problems before they become a crisis. And finally, we want to enable data-driven healthcare transformation. These innovations are primarily coming from the front lines, and we want to demonstrate in a quantifiable way how they measure and impact veteran outcomes. Another key element of this center that I want to underscore is our commitment, perfect timing, to streamline national processes for adopting new technologies. Anyone who has ever had to bring in new tech understands the clinical challenges in that journey. The privacy and information security standards that protect veteran data are essential, but we need to make it easier and faster for veterans to navigate those requirements. Otherwise, we risk slowing or even discouraging innovation. Our center has been working closely with national leaders in VHA, information security and privacy, to take a hard look at these processes. Together, we've identified where steps can be simplified, where delays can be reduced, and where we can shorten the overall timeline to get new tools into the hands of clinicians and veterans. The work is already creating a clearer path for more efficient innovation. Now, why Cleveland, and why now? Because this region is exactly what a center needs to succeed: a strong clinical infrastructure, a culture of frontline innovation, and a dense concentration of world-class academic research institutions willing to partner with us. Our center is still in its early stages, and we know our success will be defined by the strength of our partnerships around us. That starts with staff here in Cleveland and across our vision. You are the ones seeing the challenges firsthand, imagining what's possible, and building the solutions that make a real difference. We are fortunate to have outstanding universities, community organizations, and industry partners and staff who bring fresh ideas and innovation technologies to the region. As we operationalize this space here in Cleveland, we want to be at home for a true space of collaboration, not a place where partners simply deliver a finished product, but a place where we work together iteratively to identify real problems veterans are facing and co-design, validate, test, and refine solutions side by side. That level of rigor matters enormously in VA because we are not interested in adapting technology simply because it's new. I'll say this. Every piece of technology we test and every partnership we build is a service with one outcome. A veteran receives better care, sooner, and closer to home. And that brings me to the part many of you might be wondering about. What does all of this mean for you? If you're based here in Cleveland, you now have an innovation lab in addition to the existing 3D capabilities, right in your backyard. You have a space where you can access resources hands-on, support for design, prototyping, and iterative technology tools, drop-in workstations, and much more. And if you're not in Cleveland, these resources are still here for you. If you want to connect with an expert for guidance, mentorship, and explore all kinds of support that we can provide remotely. We'll be using this space to host staff from other facilities, participate in specific initiatives. Earlier this week, we welcomed innovation specialists and national program leads to do a strategic planning summit. We have future plans to host industry and academia to review commercially available products and participate in hands-on workshops to co-develop new solutions. So, as you think about the challenges your veterans are facing or ideas you've been waiting to propose, see us as a center partner. If you have specific project needs that require hands-on support, you can reach out directly to the Innovation Lab. And if you're looking to understand how the National Center can support you or your idea to navigate broader processes, you can connect with our DRHCI team. Before I introduce you to one of our biggest supporters, Dr. Mark Zhang, I would like to personally thank many folks here today who supported our team along the way. To the leaders in Cleveland, Jill and Rob, I appreciate your willingness to allow this center to come to life. Dr. Gina Green and Frank Zicko, we are here today in large part because of the innovation foundation you both have laid. I am honored to continue to work alongside you as we grow our digital and innovation portfolio. Melissa Yates, Chelsea Veda, Dr. Arash Arzan, and many other team members here who've traveled to support the center, thank you. For those that have come near and far, safe travels home. I appreciate your time and effort. Now, to talk about where this work fits into the bigger picture, I'm honored to introduce our next speaker, Dr. Mark Zhang. Dr. Zhang currently serves as Acting Executive Director of the Office of Discovery Education and Affiliate Networks, otherwise known as DEAN, for the Veterans Health Administration, where he leads VHA's research, innovation, and clinical training programs nationally and strengthens the very kind of academic affiliate partnerships that I've just discussed. Before that, he directed VHA's Office of Healthcare Innovation and Learning, where he guided the enterprise effort to test and scale innovative solutions across the entire VA system, and grew what has become the national innovation ecosystem. Dr. Zhang brings a rare combination of perspectives to this work. Before joining VA, he held multiple digital innovation leadership roles at Mass General Brigham and Brigham and Women's Hospital, including Associate Chief Medical Information Officer for Digital Innovation. And he built award-winning digital tools, including COVID Pass, that were adopted by healthcare systems across the country during the pandemic. He also maintains an active clinical practice as a palliative care consultant at the Dana-Farber Cancer Institute and teaches as an instructor in medicine at the Harvard Medical School. Dr. Zhang is a builder of communities in his own right. He founded and served as the first president of the national organization representing clinical informatics trainees, and has founded and currently leads the Professional Society Advancing Medical Extended Reality Technologies. In short, few people in VA have seen innovation work at every level, from bedside to enterprise, quite like Dr. Zhang has. Please join me in welcoming him.
Well, thank you, Dr. Riegler. Wow. So I think actually the other thing I'll just say is most importantly, I am also a palliative care doctor at the West Roxbury VA. So I see patients, I see veterans, and it's a real privilege to do that. So thank you for the time, and I'm so excited that we're all here. It's been a long time coming, and it's just so great to be here. One of my favorite kind of sayings, one of my spirit animals, I would say, is this quote, and I'm going to paraphrase it, by the sci-fi author William Gibson. And it's the future is here. It's just not evenly distributed. And what I see with DRHCI and the work happening here is maybe a little bit of the future becoming more distributed a little bit more evenly. And that's pretty amazing. The other thing I am going to do, and I'm not just vamping for time because I think we do have a schedule, is speaking of the future, I have these interesting glasses. A lot of the innovation folks are like, oh my gosh, this shtick again. And yes, it is a shtick. But I do, and it's actually pretty cool when it works. And I tell people this because sometimes it doesn't work. But these glasses are actually, they have heads-up displays. So I get my notifications, I get maps, but it's also a teleprompter. So when I do these talks now, it's actually pretty easy because I don't actually have to look at anything. I just read from a teleprompter and it looks like I'm just kind of looking out. So I'm going to try it. And I'm going to tell you this because, I would say this is the Gen 2. And the Gen 1s, I would have to tell people all the time because, it kind of failed maybe every third time. The Gen 2s actually work pretty well, all the time. So, do you guys want to try it? Yeah. All right, let's do this. Okay. Thank you, Dr. Riegler. And thank you, Jill, for setting the stage so well this morning. I have the good fortune of closing out today's program, which means I get to do two things. Look back at what brought us here, and then look forward to where this is all headed. Because today is not a finish line, it's a launch, and launches are about momentum. What Jill and Dr. Riegler described is at its core a story about trust. Trust that frontline staff know where the gaps in care really are. Trust that our academic partners can help us test ideas rigorously instead of chasing novelty, and trust from veterans that we ask them to try a new remote monitoring device or a new way of connecting with their care team, and we're doing it because we believe it will genuinely make their lives better, not because it's convenient for us as providers, but because of that trust. And that trust is the foundation for everything I want to talk about now, which is the future, specifically what this expanded center means for the broader network it serves. Vision 3, Legacy 10, covers a wide and varied footprint, with veterans in dense urban centers and also in genuinely rural, hard-to-reach communities. Historically, geographic diversity has been one of the biggest operational challenges for a network like this, and it's going to be even more so with the expanded visit. Today, I want to reframe it. It's also a real opportunity because it means the work being built here in Cleveland has an immediate built-in population to serve and learn from, and immediate relevance to facilities well beyond the visit. Here's what I see coming over the next few years. First, we'll see remote monitoring move from something offered to select patients in pilot programs to something that's a standard part of how we prevent and manage chronic conditions. The technology to do this really well already exists. What this center and the capabilities here in Cleveland give us is the clinical and research infrastructure to develop it and deploy it further. Second, I expect the academic partnerships Dr. Riegler described to deepen and multiply. Today, we're formalizing relationships with a handful of institutions. In a few years, I see Cleveland as being a place where researchers and technology developers actively seek us out. We're building lighthouses here. We built a reputation for turning promising ideas into validated, deployed solutions faster and more reliably than anywhere else in the system. Third, and this is the piece I care about most personally, having spent my career moving between the bedside and the enterprise, I expect the gap to keep closing between where a veteran lives and the quality of care available to them. That has always been one of the hardest problems in a healthcare system with a footprint this large. Digital and remote health isn't a complete answer to that problem, but it is, without a question, one of the most powerful tools we've ever had to chip away at it. Now, none of this happens automatically. It happens because of all the people in this room and the people back at your facilities who will do the hard, unglamorous work of actually implementing these programs by training staff, troubleshooting technology with patients who've never used a remote monitoring device before, sitting with the data and asking honestly whether something is working or not. So here's my ask as we close today. Take what you've heard about DRHCI back to your own facilities and your own teams. Ask where the friction points are for your veterans. Ask what a remote or digital solution might do to ease that friction, and reach out. Reach out to Dr. Riegler's team, to my office, to each other. Because the whole premise of this center is that we move faster and further together. That we do this and we can do it better than any one facility can move alone. Cleveland built the foundation. This network is going to build on it, and the veterans we serve are going to be the ones who benefit. Thank you all for being here today. Thank you to the team that made the launch possible, and let's get to work. Thank you.
All right, look like we're all set. Can we get a countdown from everybody? 3, 2, 1. All right, thank you to our attendees. Thank you for coming here today. This concludes the official portion of the ceremony. I'd like to invite everyone inside before the official tours start to join us for some refreshments and to observe the displays in the atrium. Thank you and have a great day.